Hello guys, we will shift our topic to now appendix, and we will learn about the anatomy, diseases of appendix and the complications related to it. First of all, we will discuss the anatomy of appendix. Before that, is appendix a vestigial organ? Initially it was thought to be, but now we know that it is not a vestigial organ. So what is the function of that? The function is it has immune function and also it maintains the gut microbiota. So the appendix contains lymphoid tissue which help in the defense system. It also produces IgA antibodies, so that is helpful in the immune function. Now the appendix also maintains the colonic bacteria that is beneficial to us. So if a patient had diarrhea and it is recovering, the appendix help in the repopulation of the colonic bacteria. Okay, so it is very useful and helpful organ, not a vestigial organ. If you go to the microscopy of appendix, the lumen contain crypts and the crypts contain argentaphil cells, which are also called as Kulczycki cells, which are responsible for development of neuroendocrine tumor. Okay, the appendix is supplied by the appendicular artery, which is a branch of ileocholic artery, which in turn comes from the superior mesenteric artery. Okay, one more important thing is the base of the appendix is always constant. So it is present at the confluence of the three tinea coli. So if the base is constant, how we define that appendix is pelvic, retrocecal and all? It is defined on the basis of presence of tip of the appendix. So where is the tip present? We will say that is the location of appendix. So the most common is retrocecal, after that it is pelvic, then pre-paracecal, then subcecal, then pre-ileal, post-ileal. Okay, so there is a mnemonic for that. I'll tell you. First of all, you know there is R, after R comes S, you add P2 to everything. So it is RP2, SP2. That is according to the prevalence of the position of appendix. So the first is R. R is retrocecal appendix. That is the most common. After that is pelvic. That is the second most common. After that is paracecal. That is third most common. Now we come to SP2. That is subcecal. Subcecal is after that common. Then is pre-ileal. Then post-ileal. So appendix, you know, is present at the right iliac fossa. But if there is malrotation, the appendix will be present on the left side and you may get confused with something else because malrotation is not visible from outside. Okay, thank you so much. I would again request you to like, share and subscribe. Also press the bell icon so that you get all the notification when I upload a video.